Retinitis pigmentosa is a form of dystrophy of retina in which there is involvement of rod cells first, which is followed by cones. Now, if we are talking of rod cells, so rod cells lie at the periphery and cones are maximally concentrated at the center. In fact, the fovea centralis has only cones. Now, what is the etiopathogenesis? So it can be sporadic, it can be hereditary. Overall, sporadic is most common. And if I talk about hereditary, it is actually the autosomal dominant, which is most common, inheritable. And the one with the worst prognosis, we have got X-linked recessive. So autosomal dominant and autosomal recessive, while the most common is autosomal dominant and worst prognosis is X-linked recessive. So it is more common with consanguineous marriages. Now, as I told you that there is involvement of rods followed by cones. So the earliest symptom in this disease will be nyctalopia, difficulty in night vision, night blindness. So because the rod cells are involved first, they lie at the periphery. As a result, the patient will have a ring scotoma, or you can even say in advanced stages, because the vision loss will be from periphery to central, there will be tunnel vision. Yes. And there is a typical triad of retinitis pigmentosa. Can you appreciate this bony spicule pigment? So this is your bony spicule pigment at mid periphery. So I am writing mid peripheral bony spicule pigment, and there will be the decrease in the caliber of arterioles. You call it as arteriolar attenuation. So it will be attenuated. Check out the optic nerve head. So it is very pale, very waxy. Pale and waxy optic disc is there. It can be associated with glaucoma. It can be associated with cataract. And in some cases, it has been seen that there may be keratoconus in such patients. Now, can you appreciate this image? Acha, first tell me, this image is autofluorescence or fundus fluorescein angiography. So can you appreciate the hypofluorescent vessels? So of course, this is your autofluorescence. And also check out this hyperfluorescent ring around the fovea, perifoveal region. You call it as Robson Holder ring. So this is your Robson Holder ring, and it represents the border of active outer segment dysgenesis. So this border is actually dysgenesis, and there is abnormal lipofuscin production. Abnormal lipofuscin production. Basically, this disease involves the photoreceptor layer of the retina. In retina, there are 10 layers, out of which the 9th layer from inside is photoreceptor, which is that of rods and cones, and outermost is retinal pigment epithelium. Yes. Now, it can be associated with your cysts in the retina, cystoid macular edema. So these are the things which have to be ruled out. Cystoid macular edema, which will lead to even the early central loss of vision, and there will be decreased color perception. So color blindness may happen. Color blindness will be there because there is involvement of the rods and also the cones are involved, na? So color blindness. So when the patient comes to you, so you have to, of course, examine the fundus. You have to look out for cystoid macular edema. If there is cataract, and which type of cataract will be there? It will be typical posterior subcapsular cataract. It can be associated with glaucoma, and this glaucoma, of course, is classified under secondary glaucomas because they are associated with some other cause, which is retinitis pigmentosa here. Keratoconus, you can look out for Munson sign, You can check out placido disc test and the other test that you do for keratoconus, keratometry you will do, है ना? Okay. Now after this you will also go on for checking the patient's color vision by Ishihara chart. So Ishihara chart is most commonly used for red green color blindness. I hope you all are aware of this, hai na? Okay, so what will be the management? So the investigation which is gold standard is electroretinogram. In electroretinogram there are three waves: A wave, B wave and C wave. So how will you remember? A, B, C is RMP, resting membrane potential, that is the mnemonic. R for rods and cones, while M for Muller cells, bipolar cells, while P for pigment epithelium, which is nothing but the retinal pigment epithelium. So here in the image you can appreciate that this is that of the normal eye, but that of retinitis pigmentosa, the waveforms are very much reduced. So there are electrodes which are kept, है ना, at different places. So three electrodes are used. So one is at the forehead, one is at the bulbar conjunctiva, one is on the side. So you know, so this is your ground electrode which is placed on the forehead, है ना? Okay, and one is this as this reference electrode which is placed at the surface of the skin. Another may be placed at the bulbar conjunctiva. Okay, all right. Now after having discussed this, don't confuse your electroretinogram with that of electrooculogram. Electrooculogram is done in, it is the investigation of choice in best disease, but for retinitis pigmentosa it is electroretinogram. Okay, now what will be the treatment? Actually there is not much treatment, but it is believed that you can actually postpone blindness to 40 years of age if you will give 15,000 international unit of vitamin A palmitate daily. Yes, and the other new emerging modalities are bionic eye, Argus vision, in which there is implantation of the electrode in the retina, and there is an external, you can appreciate the external coil is there, there is a camera, and the patient will have a minimum amount of vision. And of course this will not be color vision, it will be grayish, but at least the patient will be able to identify the doors of the room or maybe table or chair, so that the patient may at least move. The patient will be just able to identify that someone is standing, may not be able to identify the face. So it makes the patient a little self-dependent, hai na? Okay, all right. Now coming over to retinitis pigmentosa syndromes. One thing more I want to tell you here, that just give me a second, let me see, just give me a second. Okay, so please remember that when you do fundus examination, so on the normal image you may not be able to appreciate anything, just that you will be doing your fundus autofluorescence, in which you will be able to appreciate Robson Holder ring. That Robson Holder ring is very important. It may be asked in your Viva Voce University exam, है ना? That is the reason I came back to this altogether. Okay, now retinitis pigmentosa syndromes. So there are different syndromes which may be associated with retinitis pigmentosa like picture. So one is Usher syndrome, then Lawrence Moon Bidal or Bardet-Bidal syndrome. Then there is A beta lipoproteinemia, Frederick ataxia, Kearns-Sayre syndrome, Frederick ataxia, Kearns-Sayre syndrome. Yes, A beta lipoproteinemia. Okay, Refsum's disease. So there are many, out of which I am jotting down some important ones. Okay, now isolated atypical RP is RP like picture, but it is not associated with any systemic abnormality. Like, so what is this? This is RP, retinitis pigmentosa, sign pigmentosa. Sign matlab no pigmentation. No pigmentation. Then how you are able to appreciate? You will go for ERG testing. You will see the waveforms. There will be photoreceptor dystrophy. You will go for OCT. OCT is optic coherence tomography. There will be photoreceptor dystrophy. There will be difficulty in the night vision. So the clinical picture will be pointing more towards retinitis pigmentosa, है ना? And you can appreciate the vessels may be thready, है ना? So RP sign pigmento. Okay, what is this? This is your retinitis punctate albicans. So can you appreciate this white color dots? So instead of bony spicule pigmentation, you will see white color dots. So this is retinitis punctate albicans. Albicans, white dots which will be there typically, and you can appreciate that there is again the disc is very kind of palish and whitish like that of the typical retinitis pigmentosa. Okay, now this is, can you appreciate, there is not the entire involvement of the mid periphery of the retina, है ना? It is just one sector. So what you will call it as? You will call it as, so this is your another image, so you will call it as sector retinitis pigmentosa. Can you appreciate the image and let me know whether this is fundus fluorescein angiography or autofluorescence? Just always check out the blood vessels. So blood vessels are black in color, so this is your fundus autofluorescence, not fundus fluorescein angiography. This is your sector retinitis pigmentosa because of the involvement of one sector of the retina. Okay, so then there is Leber's congenital amaurosis. It is due to mitochondrial mutation, and you know that this mitochondria the child gets from mother. So maternal mitochondrial mutation, okay, wait, mutation, and it is seen in nearly 5% of the cases. Leber's congenital amaurosis. Okay ji, now you have a typical oculodigital phenomenon in this disease. So you press the eyes with your two index finger, and there will be photopsia. Photopsia means flashes of light, and the child will feel very good because the child has not been able to see clearly, and suddenly on pressing it there will be flashes of light and the child will have a very good feeling. So this is oculodigital phenomenon on pressing the eye with digits. As the name suggests, pressing eye with the digits. So there is photopsia, which is flashes of light. Now coming over to atypical RP, which is associated with systemic disease. So first and foremost is, which is actually the most common, it is your Usher syndrome. So there is retinitis pigmentosa, and you know the earliest symptom is night blindness, but there will be associated sensory neural hearing loss, and the onset is early, that is before 10 years of age. Can you appreciate the arteriolar attenuation? You can also appreciate some pigmentation at the mid periphery, है ना? You can also appreciate the pale and waxy disc, but it is associated with the systemic features Usher syndrome. Very important, very important. Then next is Kearns-Sayre syndrome. It is also associated with maternal mitochondrial DNA, and it is a form of encephalomyopathy. So the important feature that I want to tell here is, I have already put up a pic as well, that can you appreciate the lids here and here? So there is typically ptosis, and the features appear before 20 years of age. Typically there is ptosis in Kearns-Sayre syndrome. Okay, Now coming over to another disease, just give me a second. Yes, Lawrence Moon Bidle or Bardet Bidle. So here obesity is there, which may be associated with hypogenitalism. Here, what do you see? Can you appreciate the fusion of the fingers? So this is your syndactyly. Can you appreciate the extra that you see here, extra finger? So this is your polydactyly, and this is also your polydactyly. Yes, and this is also your poly as well as sing. Sing means fusion of the fingers. Yes, and typical signs of retinitis pigmentosa, and it is also associated with decrease in the IQ. So the mental ability of the patient is decreased. Yes, so that is your Lawrence Moon Bidle syndrome. While the last is Besson-Konswick syndrome. So it is associated with A beta lipoproteinemia, and typically there is malabsorption of fat and fat soluble vitamins, which actually lead to FTT. What is FTT? Yes, it is failure to थ्राइव. पढ़ा था ना पीजी क्लियर करने के टाइम पर, पीडियाट्रिक्स में हमने पढ़ा था. यस, बट टिपिकल फीचर्स विल बी दैट देयर विल बी white dots which will be completely scattered, है ना, and this will be visible by first decade, means within 10 years. Yes, so as the child will proceed towards 9 years, 10 years, you will start seeing white dots on the fundus, and there will be typical restriction of the movement of the eyes. You call it as ophthalmoplegia. There will be strabismus. Strabismus means squint. There will be to and fro horizontal movements or vertical involuntary movements. You call it as nystagmus, and it may be associated with drooping of the upper eyelid. That is your ptosis. Yes, so these are few features which are associated with your retinitis pigmentosa, but the important ones to understand is, one is your atypical retinitis pigmentosa, just atypical RP. Another is retinitis pigmentosa associated with your systemic disease. Most common is Usher's syndrome. Yes, Usher syndrome, Kearns-Sayre, Besson-Konswick, and Lawrence Moon Bidle or Bardet Bidle. These are the name of the scientist. Yes, and if I talk about the sectoral RP, that means only at one sector there will be pigmented bony spicule pigmentation, which will be focused on one sector. Then Leber's congenital amaurosis. Then we have got, yes, this I have just told you. Then we have got retinitis punctate albicans, in which instead of bony spicule pigmentation there will be whitish dots. And RP sign pigmento. Sign matlab no pigmento. There is RP with no bony spicule pigmentation. All right, so that was it about your retinitis pigmentosa. Prepare it well. It was my case in my university examination long back. Best wishes.